Hi, everyone, and welcome to the HGE Care presentation about our COPD program. My name is Debbie Bernstein, and I'm responsible for client implementation and relations, and I will be going through a description of our program, the details of the different details of the different types of programs. It's going to take less than 30 minutes with questions and answers, and this will give you a good overview of the program, its benefits, and how it will work within your practice. So just at a very high level, we have a very easy to use program for your patients with COPD. Patients get into a routine, and it provides simple, life-changing results for these patients. It is a technology-based solution. It can be used on a patient's computer, smartphone, or tablet. We go through, you can see there in the lower right-hand corner, the patients check in with a series of symptoms, and then the goal here is to be able to identify when those symptoms change and to identify it early so that it can be treated and the patient can go about their regular course of their day without having the disruption of finding themselves getting a little bit sicker and a little bit sicker. You can treat them earlier, have better outcomes, and be more timely. What we have found is that the earlier that the patients identify their symptoms, the more quickly they can be treated, and we can start to see decreases in utilization. So utilization in terms of it keeps the patient out of the urgent care center or the emergency room. And then also, if for some reason they do end up in the emergency room or they end up getting admitted, their length of stay is decreased because we were able to catch that exacerbation earlier on. We have phenomenal rates of patient engagement. The daily compliance is usually between 80 to 90% across the board, and we find that those are the patients that are checking in daily. They have a great understanding of their symptoms, their disease itself, and we feel that this is a testament to how easy the product is for the patients to go ahead and use. We have done studies that have gone across a very diverse patient population. I know sometimes there's the thought that patients that are older aren't necessarily good with technology. Our average patient age is in and around the 70-year-old range. So we've got not only an older population that feels comfortable checking in, but also a very diverse from a payer mix standpoint, from a race and ethnicity standpoint, and many of our patients actually have 3 or more comorbidities. So we've got some pretty sick patients going on within this program, and yet we still have that very, very high level of patient engagement. So I mentioned that the patients check in every single day. And they go through the same questions, so it really does becomes very routine for them. So the first thing that we do is we do what we call a run-in for the patients. And for the first 2 weeks, the application goes through and they check in every day for those 2 weeks so that we can learn what is normal for that particular patient. Once we've established that baseline and what is their typical symptom, then the patient moves into the Care Lite or Care Plus program. And for the Care Lite program, if there's a deviation from their normal baseline symptoms, the patient is prompted to contact their healthcare provider. For those that are in the Care Plus program, the application goes ahead and routes the information to the nursing team, and the nursing team goes ahead and they generate a recommendation for the primary care provider. And once the primary care provider, the treating provider, approves the treatment plan for the patient then receives an in-app response through the application directly back to the patient. So these are the screens that the patient sees. As I mentioned, it's bright, it's colorful, it is interactive, it's a small number of screens, it is very user-friendly. And what we do on our end, our contact center, works with the patients to have a good understanding of how to assess their symptoms, especially around the breathlessness and the coughing and the wheezing, and how to look at the sputum quantity, color, and consistency to be able to best assess those particular indicators for them. We also provide a peak flow meter, and the patient is asked to do 3 separate peak flow measurements. When they're finished, there's a submit button there at the end, and that submit button finalizes and pushes the information out through the app so that they've now completed their check-in. Are there any questions? Please feel free to ask questions all the way along the way through the presentation.
So what if a patient doesn't check in? What happens?
This is a great question. So if the patients aren't checking in, if for some reason the patient doesn't check in, they'll get a message. They can either get a text message or an email, depending upon what their preferences are. If they have not checked in for a few days, our contact center will go ahead and reach out to the patient to see if they're having any difficulty, whether they're having technical difficulties with the app, or they're not comfortable and they haven't gotten all the way through. They started to check in, but they didn't know how to use their peak flow meter. They'll go through and help coach and support the patient through the process to make sure that they're not having any difficulty with that. We do continue to follow up. It's a fine line following up with the patients. You don't want to be too naggy. At the same time, you want to make sure that everything is okay. Great question. Thank you. So the feedback is very personal for the patient. As I mentioned, the patient goes through their 14-day run-in period, and we identify what we call the patient's fingerprint, what is normal for them. Every patient with COPD has some sort of symptom going on at any given time. But it's hard for them to necessarily say, is today better or worse than it was yesterday? So this really helps us to narrow it down and focus and identify what is normal for them. And then about 85% of the time when the patient is checking in, they have no symptom change at all. So it's nice because you can get some insight into what's going on with the patient, even when there's nothing, the patient isn't necessarily having symptoms, but they're still doing their regular check-ins. 15% of the time when the patient checks in, they have some level of change, and those changes are scored whether they're mild, moderate, or significant. And even with that, with the 15% of the time when the patients are checking in and there is some change, 85% of those are mild. Like I mentioned, we do our best to make sure that we are catching those symptom changes early so that they can be treated and it doesn't continue to progress and become a much more significant exacerbation. Although there are times when we do have some that are significant. So as I had said before, for Care Light, the patient is prompted to call their healthcare provider. For Care Plus, it goes through our nurse team that then makes those recommendations, or they coordinate the care and make the recommendations for the patient's healthcare provider. So this is designed to complement your existing practice workflow. The contact center handles all of the patient outreach, recruitment, enrollment, engagement, technical support. We do everything that we can to make sure that we are taking care of all of the nitty-gritty of getting the patients engaged and oriented to the program. What we will do is we look to the practice who knows their patients the best to identify the patients that are best for the program. We work with different organizations to identify lists of eligible patients, and then we ask the practice who knows those patients the best to approve the patients that they would like to go ahead and put on service. Practices can refer patients that are not necessarily on that list, and that is absolutely fine. We do have a little bit here about, again, for Care Light, how those calls are handled, and for Care Plus, how those check-ins are handled as well. The healthcare provider and the practice staff also have access to go into our portal and look at a longitudinal view of the patient's symptoms, and in the case of the Care Plus patients, the treatment that they have, that they've gone ahead and been pushed out to the patient for their symptom change. So what's the difference between Care Light and Care Plus? So this goes through a little bit of the difference between the two programs. For all of them, for both programs, we handle all of the patient outreach via letters, phone, and text. We send the patient the welcome kit. We do the patient the patient education and the patient orientation. Handling, again, that baseline is the exact same for both programs. Patients check in every day, 365 days a year, and we've got our contact center that handles making sure that those patients that are supported appropriately, and that is for both programs as well. The identification and the symptom changes is where it starts to get a little bit different between the Care Lite and the Care Plus programs. Like I mentioned, the Care Lite, it just provides that the feedback back to the patient, and the patient then takes the responsibility for calling their primary care physician. For Care Plus, it is a higher level of care coordination because we have the nurses, like I said, that are going through based on clinical pathways, and they're making those suggestions back to the practice, and then the patient gets the in-app communication. These are, right here, are the clinical pathway suggestions based on the American Thoracic Society, European Respiratory Society guidelines. And these are the clinical pathways that the nursing team uses in order to be able to determine what the best recommendation is to put forth for the provider.
Debbie, sorry to interrupt, but does the provider have to sign off before the patient gets notified of the treatment?
Yes, absolutely. So our nurses are using these protocols because these are the standard protocols based on the professional organizations. But the provider ultimately has to make that final sign off and approve what gets pushed out to the patient. That's the way we handle that. Yeah.
Right, and more importantly, as the patient's provider, can I change the treatment from what the HGE contact center nurse recommends?
Yes. So the providers always have the best understanding of exactly what the patient is going through, and they'll have a greater certainly they're in the best position to make changes, and that is something that we recommend. While we will put forth the suggestions, providers absolutely can change it based on what's going on with their particular patients.
Debbie, I'm curious as well. Can you work with our EMR so that the treatments are documented in our charts?
Yes, so we know that while we do a lot of our documentation in our HG Med system, we also know that using the particular electronic medical records that the providers have, no provider wants to do double documentation. They don't want to document in one system and then have to go and document in another. So what we are doing is we are happy to work with different organizations to identify the best workflow within your organization. And actually, that's a great segue into my next slide. This is one solution that we have worked with for one of our clients where we are coordinating, documenting for the sign-off in their own electronic medical record. So what we do is we've got the screen excerpt of the symptom change and the treatment recommendations that are going to be pushed through, and it gets put into an order in their system, and it gets pushed to the provider for approval. So we're able to go ahead and take that. Sometimes it's called a snippet, sometimes it's just called a screen grab. So we're able to take that, put that into the EMR, and then when the provider signs off, we then go back, take that sign off, and we put it back into our system to be able to then continue to track those the treatments. And as you'll see when we look at the 30-day reports, you can start to see that this way we're getting the best of both worlds, supporting the providers with their documentation in their electronic medical record, but also being able to make sure that we are still monitoring those symptom changes. So I mentioned the HGE portal, and this is a screenshot of the HGE portal. This is our patient Luke Skywalker, and these are Luke's check-ins over the longitudinal period of time. So you can see that Luke's anchor date is there on the left-hand side in sort of that tan peach color, and then all of the check-ins are in reverse chronological order, with the most current right up next to the anchor / baseline. And you can take a look at this for a 15-day period, a 30-day period. You can take a look at a longer period of time, and you can see the scoring that is up there on that top bar. The green is where there's been no change in symptoms. The yellow is where it's been mild. The orange color is where it's moderate, and the red is where it is a significant change. It goes through the very specific details of the exact check-ins and what the differences are for each particular metric.
So do we have to log into the portal every day?
So, you absolutely do not need to log into the portal every day. I think that when there are practices that have large numbers of patients that are on service, they may want to log into the portal every day. But really, there are two times when you would want to log into the portal. One is if you have a patient that's on Care Lite and you would like to be able to see what their symptom changes are. Patient calls in and said, you know what, I had a symptom change and I know I need to call my doctor. Logging into the portal at that point, you can pull up to see exactly what the symptom change was, and it can help with making some clinical decisions. And then the other time when we usually suggest using the portal would be if you're doing your pre-visit preparations for an upcoming office visit. Patient is coming in tomorrow, and you want to make sure that you talk to them about their COPD and how they're doing with the HGE Care program. This gives you the opportunity of doing that, but you absolutely do not need to check in every single day, not necessary. So, but it is here. It is a resource for you. All right, so another service that we provide is to make sure that you've got the information about how your patients are doing. So we send out these monthly reports. This is a sample of a patient that with all of their check-ins. There's a summary page, and then it goes through the 30 days, the last 30 days of their check-ins. And it goes into the details in terms of day by day, all of the different symptoms that are reported. The baseline is always appears up here at the top, and then where there was treatment, what exactly the treatment recommendations were, and who signed off. So this gives you an insight. We send these out on a regular basis, and they can be printed and put into a paper chart, scanned and incorporated into the electronic medical record. So this is one of the additional tools so that you can have a snapshot of exactly what's going on with your patients.
So when will we receive these, and in what kind of format will we receive them?
So these come out, what we do is we wait until so we want to give a full 30-day picture. So, and patients can check in up to midnight on any particular given day. While we encourage that they check in the morning, they can check in all the way up until midnight. With that, we wait until the patient, that day has completely closed, and the following day we work to start to prepare these reports. So these are then produced, they're put in a PDF format, and we can send them via either secure email or secure fax. We are having some discussions and working with our local health information exchanges to see whether there are ways that we could share this data through an HIE as well. So it's always great to hear what other providers have to say. And this is just a quote from one of the physicians that we've worked with at Einstein Health, talking a little bit about how it's been a game changer for his particular practice. One of the things that we think is particularly powerful about the application and how patients are able to use it is that the patients are more engaged, but also the patient's checking in every day. So while no provider and no clinical practice can check in with a patient every single day, what's always the most concerning is what happens in between visits, right? The providers see the patients and they go through their treatments and they talk to the patient about what they're supposed to do, and then there's a long period of time before they come back. And this means our application gives the patient an opportunity to check in every day and the provider some insight into what's going on in between those two visits. So as Dr. Beam said, HGE Care allows you to never turn your back on your COPD patients while adding little, if any, work to your daily list of things to do. So, of course, I do want to make sure to point out that this is a patient support tool. It is a tool designed for the patient to improve the patient's self-management. So we provide the information to the providers so that they're able to help and manage their patients and help the patients better understand their disease. It is not a real-time monitoring system, so it's not an alert system or an alarm system. And it should absolutely never be used as a substitute for professional healthcare judgment. It is supportive information for the providers and practices to use to help their patients. Only a healthcare provider, though, should be interpreting that patient-reported data. So you're going to receive a program launch packet, and here are the contents that you'll get. You'll get the overview, how we selected the patients, what the sample patient outreach letter so that you can take a look at what the patients are going to be receiving, and the list of your potential patients. That's what's in your launch packet itself. So here are the next steps and what we're going to ask of your particular team. So you'll get that launch packet with the contents that I mentioned. And over the next week to few weeks, please review and approve the patients for outreach and enrollment, selecting Care Lite or Care Plus for each patient. We are going to ask that you just complete the HGE Care training for providers and staff, to complete a quiz, return your patient listing to our HGE practice engagement team. You can do that via email or secure fax, and both of those are right up here on the screen.
Hey, Debbie, I'm curious, how much time do I have to review my patient listing?
So generally speaking, we like you to review that within a week to 10 days, 2 weeks max. The sooner we can get those lists turned around, the sooner we can get our letters out to the patients so that we can get that enrollment process started.
Can a patient be moved? I'm sorry. Can a patient be moved from Care Lite to Care Plus?
Yes, so that's a great question too. We have both programs, and those patients that are initially identified as Care Lite have a tendency to be those that are not quite as sick. They're a lower gold level with their COPD. So those patients are put on Care Lite. As their disease progresses, you may find that you want to move them to Care Plus. That is not a problem at all. Just let us know, and we will go ahead and we will change their status to make sure that the workflow within the app is changed for them.
Excuse me, do you just send them a letter, or do you do phone calls also?
So we do phone, so we start off with a letter. So the patient receives their letter, and then what we do from there is we go ahead and we make 3 outbound phone calls, and with those outbound phone calls, we do 3 separate times of day so that we can make sure that we try to catch the patient. So we do, and it's over a course of 3 weeks. So we make morning phone calls, we make afternoon phone calls, and then we also make phone calls in the evening to try to catch the patient in a time that is best for them. If we reach them in the morning and they say, I'd rather speak to you in the evening, we work with whatever works best for those patients. So yes, we do more than just a letter, but we also have the ability to do secure text as well.
Can we enroll patients that we see in the office? How would we do that?
What we do, generally speaking, what we can do is we can leave you with the patient welcome kit. So once we get a patient on board, we send them a welcome kit, and that welcome kit contains a patient handbook, their peak flow meter, and a magnet for them to keep all their essential details, the essential details of the program handy. So what we can do is we can give you 5 welcome kits to keep in your office, and when you see a patient that has COPD, you can go ahead and enroll the patient in the COPD program. You can hand them the box. They can take that. There is a contact card right there, and they can go ahead and they can call us, and we will make sure to get them activated and get them engaged in the program itself. The only thing that we do ask is that you send us that contact information so that we can make sure to load them into our system, and we'll reach out to them as well if they've not had a chance to reach out to us. Are there any other questions, any other things that I can answer for you?
I think I'm good. Yeah, thank you, Debbie.
All right.
Nothing for me.
Thank you very much. I'm sorry, was there another question?
Nope, nothing for me.
Okay, so thank you very much for your time. If you need to reach us, you'll be receiving a copy of this slide deck as well, so you can go ahead and there's contact information in there. Thank you everybody for your time today. I really appreciate it.
Thank you. Thank you.
How about